And good morning, everyone. Thanks so much for being here at the Eastern Water Reclamation Facility. We appreciate you being here with us this morning. Thanks to our host, Utilities Director Ed Torres, who is here, and our media and communication hosts, Debbie Sponsler and Sarah Lux. Thank you so much for making this happen. Today, the mayor will discuss utilities, what happens here at this facility, its importance, especially as it relates to the COVID-19 pandemic. The mayor will provide details on testing and vaccination sites, as well as our positivity rates and a brief outline on our emergency rental assistance program. Dr. Raul Pina from the Florida Department of Health in Orange County is here, and the aforementioned Utilities Director, Ed Torres, will bring comments as well. We begin with Mayor Demings. Mayor?
All right. Thank you, Dr. Williamson. Thank you to all of you. I think we're going to have to adjust the mic slightly here upward. There we go. All right, and let me just start by saying good morning to you. Before we get started, I wanted to talk about the situation in Haiti. Our hearts go out to the Haitian people who are not only facing the tragic loss of life from Saturday's earthquake, but the possibility of flash flooding and mudslides from the tropical depression Grace. Here in Orange County, we will be communicating with the local consul general, the representative from Haiti, regarding next steps of how we may be able to best assist that country in the coming weeks. We ask that you all please keep the people of Haiti in your thoughts and prayers, and again, we certainly understand some of the concerns that our residents here within Orange County may have because of their loved ones back in their home country. As far as the tropical depression Grace is concerned, with Florida, the latest track shows no direct impact on our state at this time. So I'll just transition and talk now about today's event. Since May, Orange County has been actively participating in the CDC's National Wastewater Surveillance System. It is part of a national network of wastewater treatment facilities monitoring the coronavirus across the United States. The purpose of this monitoring, and why we brought you here today, is to show how this helps us understand the spread of the virus within our community, and how those concentrations reflect both symptomatic and asymptomatic infections. Knowing where there is a high concentration of COVID-19 RNA in wastewater helps us understand the spikes, trends, or outbreaks, and allows for increased preventative measures and allocation of resources to areas showing high infection here within our county. In our county of 1.4 million residents, Orange County Utilities serves about 870,000 people, more than half of our residents. And it is a great barometer of where the coronavirus is concentrated. Outbreaks and infections can be predicted as early as 4 days. In a moment, our Utilities Director, Mr. Ed Torres, will have the latest numbers and will show you exactly how our utilities employees monitor wastewater for COVID-19 RNA. Now let's talk a little bit about the vaccination and where we stand. I'm pleased to say that the message is getting out here within our community as more people are going to Camping World Stadium to get the vaccine. On Saturday and Sunday, Camping World closed the drive-through line early due to demand. We are able to vaccinate up to 750 people a day at Camping World, and our Orange County Health Services workers can handle more if needed. One announcement: starting today, Camping World will be administering Pfizer only. Our supply of the Johnson & Johnson from the state of Florida has not been replenished. So from now on, it will be only Pfizer that will be given out at Camping World Stadium. And remember that no testing occurs at Camping World, only the vaccination shots. As for our 3 testing sites, the response for getting COVID-19 and antigen PCR tests remained very strong during this last week and weekend. At the newest testing site, the former Claricona Elementary School, they saw nearly 1,300 tests that were administered on Saturday and Sunday of this past weekend. At the Econ Soccer Complex, over the weekend, they saw a total of 2,641 tests that were performed. And finally, at the Barnett Park location, the numbers continue to be high. 2,900 tests were done over the past 2 days. So in all, over the weekend, the 3 testing sites administered nearly 6,800 tests. All 3 testing sites plus Camping World Stadium's vaccination site operate 7 days a week between the hours of 9 a.m. and 5 p.m. And now I'll move to talk about the coronavirus numbers or the cases specifically. There are now 188,724 positive reports of the coronavirus within our community. So approaching 190,000 cases. I never thought that we would ever get to that number. On Sunday, there were 1,020 new cases reported in the county on that day alone. Dr. Pino will get more into the details. The number of deaths in Orange County continues to rise. We are now at 1,452 deaths. That's 10 more since Thursday's briefing. Our 14-day positivity rate is leveling out at 20%, still much higher than what we want to see within our community. And for those 12 years of age and older who have received at least one shot at this point, we're over 65% of our residents. Now let me talk a little bit about the I Got My Shot trailer. It's continuing to move throughout our community. This week it will be also at the Lake Buena Vista factory stores on State Road 535 until 1 p.m. That's today. Then the vaccine trailer heads to the Dover Shores Neighborhood Center this afternoon. And on Tuesday morning, the trailer will be at the Chick-fil-A at 1800 Sand Lake Road. Later that afternoon, the trailer will be at the West Oaks Mall by the tax collector's office. On Wednesday morning, it will be at the Orange County Courthouse in Ocoee. A second trailer will be at Lake Eola Wednesday morning. Then Wednesday afternoon, the trailer will be located at the tax collector's office, located off of Lee Vista. And Thursday morning, the trailer will be at the Smith Neighborhood Center on Bruton Boulevard. So you can see we're truly moving throughout the community. Also on Thursday in the afternoon, it will be at the In-Town Suites Extended Stay on Lee Road. For more information, you can go to our website at ocfl.net/IGotMyShot. And finally, a little update on our rental assistance program. In terms of our program, we're moving around the county and select library branches between the hours of 10 a.m. and 1 p.m. for the remainder of August. The program will be at the South Trail branch on Tuesdays, South Creek branch on Wednesday, the Fairview Shores branch on Thursday, and the Chickasaw branch on Fridays. At this point, we have given out over $6.5 million to residents within Orange County that has positively impacted 1,177 families, which have been able to stay in their homes. And with that, I'm going to turn it over to Dr. Pino at this time.
Good morning, everyone. Good morning, Mayor. Thank you. The mayor mentioned to you that we are 188,724 cases, and our positivity rate for the 14-day rolling average continues to be around 20%. The numbers of deaths are 1,452, with 10 additional added since we talked to you last time. The total number of deaths in August, we are August 13 today. Is that right, 13? No. What day is today? 16. So we are at the 16th day of the month. August so far has 28 deaths. So although we have not made any calculation because the numbers are quite low still, it is safe to say that there is an increase, at least in the first half of this month, has been an increase in the rate of death from this new wave of the pandemic. We also want to dedicate some time to explain to you our strategy for testing in the schools. So we are going to use two strategies to test in the school. One is going to be during school hours, and the other one is going to be after school hours. I'm going to explain today after school hours because that's the one that we are going to start today. And then I will just give you a little bit on the schools, in school testing, which will depend on additional funding that we are expecting from the state. So we are going to start testing from 4 to 8 o'clock every day, including weekends, at each different commissioner districts for the board. Each of the board member district, we will have 1 day a week, and we will be at the same location every day of the week. Meaning on Mondays we will always be at that place. So on Tuesday, Wednesday, Thursday, Friday, Saturdays, and Sundays. During the weekdays, 4 to 8, that will be intended for students, the family of those students that goes to that area, and employees of those schools that goes into that area from OCPS. It's not intended for the community at large. That's what we have the other sites. We don't size these sites to be overwhelmed. It's intended again for OCPS. And we are going to use PCR and rapid testing. Now, the Saturday and Sundays will be open from 10 o'clock in the morning to 4 p.m., and that one will allow anyone from the community to come and test. So this Monday, or every single Monday, we will be at Catalina Elementary School, and that will be from 4 p.m. to 8 p.m. You can go into the OCPS website, and if you have additional questions, you can ask Scott, who is here too. And then after we get the additional resources that we are expecting from the state, and if we get approved, our next level is also to do in-school testing. That in-school testing will be any time that anyone within that school show up symptoms. It is intended for symptomatic people. The idea beyond that testing is that we can quickly identify anyone who may have developed symptoms, either show up to school with symptoms, employee or student, or during the school hours, and we want to rapidly exclude this individual from the classroom or the environment if the person has become positive. For this one, we will use PCR, a rapid PCR, and it will be confirmed if necessary. Now, it is important to know that we need parental consent form to test any students. So for those who are going to show up at the after-school testing, you need to have a parental consent with you, and you have to have your parent with you because more likely you will be a minor. For those who are 18 and older, of course, they can make those decisions themselves. With that, I will pass the microphone to Ed Torre, the Utilities Director, and then I will answer any questions that you may have. Thank you.
Thank you, Dr. Pino. And good morning. As mentioned by Major Demings, Orange County is actively participating in the CDC National Wastewater Surveillance System, where concentrations of SARS-CoV-2 RNA are being monitored in the wastewater through facilities around the country to better understand the spread of the virus. Orange County Utilities started sampling back in mid-May of this year, again for copies of the virus of that RNA that we can find in the wastewater. And those RNA concentrations, as the mayor mentioned, can give us an idea of both infected, asymptomatic, and symptomatic individuals. What we measure in the wastewater are fragments of the virus that are non-contagious, non-viable, but that provide us with an advance warning and serves as a predictor of upcoming clinical cases within the coming 4 to 10 days or so. Similar wastewater surveillance programs are being used around the world as a very effective tool against the fight against the pandemic, determining spikes, trends,
and allocation of resources and public health preventative measures. Now, here in Orange County Utilities, we provide services, as mentioned, to 870,000 people in 3 different service areas. Today, we're at the Eastern Water Reclamation Facility, which serves over 280,000 people right here in our community, and is one of the 3 areas that we sample. Although the results fluctuate, the concentrations of the virus RNA that we're seeing and that we measure show an overall increasing trend in our service areas. And that's what we look for. Not one concentration, but the trend over time. And again, I want to highlight this. What we measure are non-contagious, non-viable fragments of the virus. But that still can give us an idea of what's to come. It's a great predictor. When we started sampling back in mid-May, our concentrations that we were getting in the 3 service areas were around 200,000 gene copies of the virus per liter. Our latest results from this past Thursday are showing right here in the Eastern Service Area concentrations of 2.073 million, almost 2.1 million gene copies of the virus per liter. That's a 674% increase from what we had in mid-May. In the South Service Area, the concentrations that we have as of last Thursday is 1.252 gene copies of the virus per liter. Again, 1.2 million. And that's a 740% increase from where we were in mid-May. In the Northwest Service Area, the concentrations are at 1 million gene copies of the virus per liter. And that's a 558% increase since mid-July. I can tell you that both in the Eastern and in the South Service Area, we saw an increase in concentrations from Monday's concentration through Thursday's concentration. However, in the Northwest Service Area, we have seen 3 samples back-to-back with lower numbers, which is an encouraging fact there. Hopefully that continues to decrease as we move forward. Nevertheless, these concentrations, again, if you picture that we were at 200,000 and we are in the million, these are very high and very concerning still. To put it in perspective, I have been working with wastewater-based epidemiology almost since the beginning of the pandemic in another utility, since April of 2020. And the highest concentration that I recorded during that time was that the first wave of the virus infections was 2.8 million gene copies of the virus. We have now exceeded that with 3 million copies of the virus right here in the East Service Area on July 29th. And we have been very close to that 2.8 million that we had early on, now in the Northwest area at 2.6 million also in July 29th. Again, the results of the virus RNA that we measure in the wastewater indicate that we will see continued clinical cases and hospitalizations this week, even beyond what was reported this weekend. So please, we urge you to get vaccinated and to continue to take the appropriate precautions. Are you ready, Dennis?
All right, we'll open it up for questions. If there are any questions in Spanish, we have the ability to do translation. I believe Commissioner Gomez Cordero I saw coming up. We also have Ms. Ilia Torres, who's here, that can do translation. I don't see anyone from the school district back there. Oh, yeah, Scott Howard from our school district is there in the audience as well. And our Public Safety Director, Danny Banks, has joined us. So we'll open it up for questions at this time. Okay, I believe we're moving the microphone around.
Steve Hudak from the Orlando Sentinel. Sorry about yelling there. I was wondering if I could have a question of Ed Torres.
Yeah.
Mr. Torres, how long does it, when you have these numbers, how far out does it take for these hospitalizations to result from the numbers that you, I mean, I'm not really phrasing this question very well, but do you kind of get the gist of what I have?
I follow what you're saying. So again, from the moment that we get that sample, that the sample was taken, it takes a couple of days to get analyzed. But from the day that the sample was collected, we see the clinical cases to follow again within 4 to 10 days. And that ranges a little bit. Remember, we're seeing both symptomatic and asymptomatic infections. The hospitals and the medical providers are seeing only the symptomatic patients. And I didn't show you this earlier, and it's hard to see maybe from the distance, but you can see how our concentrations since May through the beginning of July were pretty flat around that 200,000 that I mentioned. Thereafter, the concentrations just went up and have continued to have that trend.
This is Melissa Thomas with Florida National News. This question is actually for Mayor Demings. I just wanted to piggyback off of what Mr. Torres reported earlier. Given the numbers that he's seeing now, like as of Thursday, what's normally the next steps in the sequence? When you see an increase in samples like that, what's usually the next step in the sequence for Orange County to do?
Well, what we do is coordinate. We provide the data to the Department of Health, to Dr. Pino, and it gives us one indicator that we have to then go through and validate through hospital admissions, through the test results that we receive within our county, and we have to make decisions about any adjustments. The reason why we're geographically located here at the Eastern plant today is because this is the area that has the highest concentration. So what we try to then do is ensure that any messaging to respective communities can be focused in a particular area as we begin to try to provide accurate and timely information to our residents so that they can take appropriate precautions. We want our business community to take precautions for their employees and their patrons, and we want our residents to take precautions such as wearing the facial coverings if you're going to go out to dinner and be in an enclosed space. You know, we want you to wear your facial coverings until you're eating, and also consider the social distancing and other things that need to be taken into consideration. So it's just one of many indicators that still need to be validated by hard data based on our actual experience here within Orange County. Okay.
Hey there, Nadine with News 6. Dr. Pino, I have a question regarding testing in schools. So is it going to be like every day in a different district? So Monday is at Catalina, and then Tuesday will be at a different district?
Correct.
And the reasoning behind this, and then it's a lot of confusion. Do parents need to give permission for kids in school testing with symptoms? I mean, would parents be okay with that? So there's a lot to it.
So the in-school testing has not started. That will be if we get additional resources, which we are expecting. And at that time, we probably consult with the State Health Department and create a consent form that we already have, but one that could be extended, like anytime that you need to test my child, it can be tested. That type of authorization during that period. At the same time, probably parents who don't want the kids to be tested, they say, we'll get there. With regard to the after schools testing, the intention is to give the visibility for parents that may be at work, that don't have those resources, that cannot take a day off, to come and get tested as a family unit. That is the intent, because the child doesn't live alone. So as we said before, the child is just a vector between the school and the home, back and forth, but it's the same environment. We are all one community. So the idea is to offer that testing for families and children who may not be able to take advantage of the other sites that the county has opened. The idea is also to accelerate testing for schools so that we can prevent infections in the schools. The idea with the rapid testing in schools, when we get there, that one is intended to catch any cases that may have come to a school symptomatic or may develop symptoms in their travel to school, or employees, but also for anyone who may develop symptoms during the entire day of the school operations.
Excuse me, Lauren Seabrook, Channel 9. Mayor, this is for you and Dr. Pino. I'm wondering if you guys have spoken directly with any of our local hospitals lately. We've been hearing a lot from doctors and nurses within the hospitals who seem to be calling out for help. Some are asking for field hospitals, saying that they're running out of space. We're not hearing that as much from the hospital spokesperson. So I'm just curious if you guys are hearing any of that directly from them.
We're not hearing that directly from the hospitals. We are in daily communications with our hospitals. We have an executive policy group call several times a week. And yes, the hospitals only are limited by the staff. As you've heard them explain, it's not so much just about the actual bed itself, but everything that has to be put in place to support that bed, all of the staff. And so they clearly are running into some critical numbers at this point before we would need to set up any type of community type of a hospital or MASH hospital setup. They would look internal to their facilities. It's all about the staffing, and so Dr. Pino certainly has been in communication with them, and I'll let him respond what he's hearing. But we do hear a lot of chatter within the community about the hospitals being overrun. There's no question that the hospitals are busy and they don't have a lot of flexible space at this time. I only know that because I've communicated with the families of several of our employees who are hospitalized. Some are in critical care units, some are in the hospital. And from the families who I've communicated with, there have been some challenges sometimes with getting bed space, especially if they are non-COVID related patients. So it's a bit of a challenge for us. Dr. Pino, you want to add to that?
I mean, we have been in communication with some of the hospitals in the area, and they are all experiencing a high volume of cases. Now, they do always address the issue that they have enough PPE and other resources to take care of the patients. And the issue is not so much about capacity itself, in the sense that they still have some capacity, although that could run out soon. The issue is that because they are in this influx of COVID-19 cases, there are other things that has been postponed and cannot be taken care, the regular cases. So there are cases waiting for a tumor to be removed. There are cases, a knee replacement that has been postponed, and that's all the issues that the hospitals are very concerned, because when this happened before, in one of the waves that we have, and elective procedures were removed, then when regular patients will come back to the hospital, they are sicker than they were at the time that the diagnosis were made. So it makes those cases even more complicated. And that's the concern that the hospitals are really, really expressing. If there's non-COVID-19 cases, what do we do?
Dave McDaniel from Channel 2. I have a question for Mayor Demings, and I could follow up with Ed as well. First, Mayor Demings, so you obviously say that on the east side where we're seeing these spikes, you're hoping that people will take necessary precautions. How frustrating is it as you work to try to boost the public health future for the county that there are still some people that aren't playing by these safety protocols?
You know, it's unfortunate that we do have some people in our community who are not paying attention to the science or don't believe it. But each day, I believe it gets better because what we see as infection continues to spread, it gets closer and closer to an individual's family. And because of that, we have seen a shifting in some of their beliefs. And so I remain highly encouraged. I want to also go back to the issue about our hospitals. We do see with our paramedics, we see where they are taking patients to the hospital and not being able to go back in service because they have to stay with that patient until they get a bed or they get a hospital staff member that that patient can be transitioned to ensure the continuity of care. And so it does impact when we see the backups in our hospital. It impacts us in terms of our delivery of service countywide. With that, the question, you had an additional question for Ed Torres. Ed?
So we are testing for 8 mutations, 6 variants. Okay, remember each variant may have as many as 24 different mutations. Each one of those are going to vary. For each variant, we're testing for the most prevalent mutation for each variant. Those are not measuring concentration, they're measuring percentages. And just to give you an idea, the one that we're most concerned about is the Delta variant. And unfortunately, just like the concentrations, we saw from May and June, the percentage of the Delta variant, that particular mutation that is the most prevalent, increased from 15 to 20%, round numbers, to 98 and 100% through our current numbers. Again, through that period of time, those first 2 months of May and June, 15 to 20%, jumping to 100% on that Delta variant. Thank you.
I have a question to follow up. I guess it would be Mr. Torres and possibly the mayor. Holly Bristow with Fox 35 News. Hi, gentlemen. When you get these numbers back and you're seeing spikes in different parts of the counties, can you give us an example of decisions that have been made because of spikes in numbers that you're seeing, aside from holding today's news conference here because you got a big spike here?
Well, I think you have all seen that. The mayor has taken action with regards to testing sites and vaccination sites based on that data. And I'll leave it at that, and the mayor can elaborate on that. But we saw increases in this area, and we saw increases in the northwest area, and decisions were made based on those concentrations and seeing the increases, which were going to be followed by increases in clinical cases in those specific areas.
Ed is precisely right. When we have made decisions about where we would set up additional testing sites, where we would set up additional vaccination opportunities, we've taken that into consideration. And then the collateral materials that are being produced by our communications division, we've been working with our Board of County Commissioners to ensure that we provide them with information so that they can communicate with their various constituents. And they're reaching out to community-based organizations to partner with them. We continue to also see a fairly active participation from our retail pharmacies where vaccination opportunities are being provided there. And so we're just correlating and coordinating the information to ensure that we are responding in a timely manner to what we're seeing here on the ground in our community. Okay.
William Díaz, más 100.7 FM, es específicamente para Dr. Pino o el Mayor Demings. ¿Tienen idea de cuándo estará disponible las vacunas de Moderna y de Johnson & Johnson? If the question is if for Mayor Demings or Dr. Pino, if have any idea of when we'll have back the vaccines from Johnson & Johnson and Moderna. And it's due to the fact that some people start also traveling, they haven't get the vaccine already, and they need to get one shot, for instance.
So Johnson & Johnson, at this point, we have no ability to order Johnson & Johnson. That will change, I believe, but right now the state have advised us that what we have is what we have, and they will let us know if in the future there's going to be more to order. With regard to Moderna, It can be easily ordered. It's available. We are handling more Pfizer than Moderna because our county, thanks to the county, they acquired the technology for Pfizer. So we are allowing other counties that may not have those resources to order the Moderna, which now requires deep freezing temperatures. But we can have both. En español, Johnson & Johnson no tenemos la capacidad de ordenar en estos momentos. Lo que tenemos es lo que hay y no sabemos si se va a poder ordenar, pero nos dejarán saber. Con respecto a Moderna, aunque no la tenemos tan disponible como Pfizer, la hay en el condado y la hay en otras áreas y siempre se puede ordenar, está disponible.
Doctor Pino, si por favor nos hace un pequeño briefing, un pequeño resumen de por qué estamos acá hoy y la pregunta directa también para usted y para el Mayor Demings. Al sol de hoy, ¿cuál es la principal preocupación que ustedes tienen? ¿Creen que se está haciendo lo suficiente y la comunidad está colaborando con ustedes para disminuir este alto índice de COVID, pero también de hospitalizaciones?
So, two parts. One, if I can summarize a little bit everything that I said in Spanish. And the second one for the mayor and I, if we think that we are getting sufficient support and collaboration from the community as we face these new phases. Para la primera pregunta, también dijimos, aparte de dar una orientación a la comunidad latina, es que vamos a ofrecer pruebas de COVID-19 en las escuelas. Vamos a comenzar hoy en Catalina Elementary School y la idea es que tenemos 7 regiones que corresponden a los diferentes miembros del Board de Educación y vamos a estar en una región cada día de la semana. Vamos a estar siempre a la misma hora y siempre en la misma escuela. Y le pedimos a ustedes, por favor, que traten de ir a la escuela que le corresponde al área de ustedes si se quieren hacer la prueba con nosotros. Las pruebas van a estar abiertas de 4 a 8 de la noche, lunes a viernes, y el domingo, y el sábado y el domingo estarán abiertos de 4 de la tarde a 8 de la noche. Le pedimos a la gente del público en general que no asistan a las escuelas entre los días de semana porque los números son limitados y queremos concentrarnos en los estudiantes, sus familiares y los trabajadores del sistema escolar. También tenemos otros testing sites alrededor del condado que pueden ofrecérselo a las personas en general. A la otra parte, yo creo que sí, la gente está colaborando lo más que puede. Hay un segmento de la población que se niega a vacunarse, como lo sabemos, y que se niega a colaborar, y eso es una decisión personal de cada cual, pero con el tipo y el volumen de infección que tenemos, toda persona que no esté vacunada debe esperar que va a experimentar de alguna manera esta infección, ya sea sintomática o asintomática, pero yo creo que de esta no nos escapamos si los volúmenes continúan de la manera que continúan. The second part of my answer with regard if we are getting collaboration from the community, I say I believe so, although we know that it's a segment of the community that refuse to get vaccinated, and that's a personal choice, and also refuse to take all the precautionary measures. But the reality is that anyone who is now vaccinated at the level of infections that we are having should expect to get this infection if you don't get vaccinated. You may experience it asymptomatically, but the levels that we have right now, I don't think that many people could escape this infection if we don't get vaccinated.
I think my biggest concern is that a person who could be possibly prevented from getting the virus doesn't get the vaccine in time to prevent themselves from being infected.
Mi mayor preocupación es que una persona que pudiera recibir la vacuna no la reciba a tiempo para prevenir una infección.
And so that's why we continue to do these press briefings, and we continue to work with our media partners on this public health pandemic to encourage everyone who's eligible to get vaccinated to seriously consider getting vaccinated.
Por esa razón que nos mantenemos haciendo estas actualizaciones periódicas para hacer un llamado a esas personas que consideren seriamente recibir la vacuna, si así pueden hacerlo.
Okay, thank you for the question, and I'm not sure where the mic is at this point. Okay. No other questions? All right. If there are no other questions, what we're going to do, if you see the gentleman over to my left, to your right, they are going to be taking out a sample, and we're going to reconvene in that area if you want to actually see a sample being extracted. Thank you all for being here. The next press briefing will occur on August the 19th, this coming Thursday.